panelists very much. Welcome to the Lunch and Learn for today from the Transportation Equity Task Force of Able, New Hampshire. We're really glad that you were able to make it. Just as housekeeping, I want to let everyone know that the meeting's being recorded and the recording will be shared with folks on our website and on social media channels in the future. And this is the reason why much of the audience is muted and the screen sharing and cameras are turned off. But you may use the chat throughout the meeting, and also you can raise your hand if you want to be recognized for the more interactive portions of the meeting. Advocates Building Lasting Equality in New Hampshire advocates for the civil and human rights of children and adults with disabilities. We promote full participation by improving systems, connecting families, and inspiring communities, and influencing public policy. Able New Hampshire is an organization that is made up of many advocates from across the state. And it has several task forces that are running. Those task forces are chosen by the people we serve every year. And at the annual meeting the year before last in 2023, the folks decided that we should encourage a transportation equity task force. So that is the task force that's sponsoring the Lunch and Learn that we're at here today. If you want to learn more about the Transportation Equity Task Force and everything that we're up to, you can scan the QR code that's right there. And also after this meeting, you'll get an email that leads you to the same information. One of the major endeavors of the Transportation Equity Task Force right now is the Lunch and Learn series. Our next Lunch and Learn is going to be on June 20th. And we're going to be talking about non-medical transportation service option. That is a Medicaid waiver service option for everyday transportation. In July, we'll talk about non-emergency medical transportation. August will be the volunteer driver initiative. September is the Keep New Hampshire Moving website, and we're going to learn something about that today as well as sort of an intro. And then October, we'll do the Welcoming Transportation 101. Today, we're here to hear from our mobility managers. They are New Hampshire's community transportation partners. We're really glad that you came. And now I'm going to turn it over to Teri Palmer, our statewide mobility manager, to introduce herself and our other panelists.
Thank you, Lisa. Good afternoon, everyone. I know it's probably pretty hard to sit behind the computer screen on a beautiful day like today, so thank you very much for joining us. Like Lisa mentioned, my name is Teri Palmer. I'm the statewide mobility manager, and I oversee the regional mobility managers. Currently, we have 8 regional mobility manager positions, and we have 6 mobility managers actively working within the state of New Hampshire right now. We are looking for 1 mobility manager for Grafton Coos and Carroll County. So if you know of anybody after you hear our presentation that might fit into this role, please reach out to me and let me know. Okay, so do we have our slides up yet? And while I'm waiting for the slides, I'll introduce, you'll hear a little bit more about Cindy and Ben, but Cindy Yanski is our regional mobility manager for the Belknap, Merrimack County, so it's the mid-state regions. And Ben is our regional mobility manager for the Manchester, greater Manchester area. All right, perfect.
Okay, you can see the slides?
Yes, thank you. And we can go to the next one. Okay, so a lot of people ask us, what is mobility management? What exactly do we do? Because we don't actually provide trips. So what we do is we help connect people to the transportation options, whether it's public transit, volunteer driver programs. We also work within the bike ped communities. I know we don't have a lot of rail systems in rail and airports right now. We're dabbling a little bit in that, but we really focus on public transportation, volunteer driver programs, and bike ped. So we call this community transportation. So as you hear that phrase throughout our presentation, that's what we're talking about, is all things transportation. So what we do is we help connect people to the community transportation options. that help get them to their destinations, whether it's non-emergency medical transportation, it's work, it's social events, anything like that. And Cindy and Ben will go a little bit deeper into that. Next slide, please. And then the other thing that we do, and this is really a lot of my role as well, is we work across sectors with all of our partners. As you all know, what happens in Manchester is not exactly, the type of communities in Manchester area are not the same type of communities up in the North Country. So the regional mobility managers really get to work with their community partners and understand the transportation needs in their communities. And then we all work together to either expand transportation options or start new transportation. And Ben can go into a little bit of the work that he has done as far as working cross-regional to start new transportation in an area that hasn't had any transportation for quite a while. And then at the state level, what I do is I work with folks like Department of Health and Human Services, Department of Transportation, so this is our network. So you'll see that at the very top are the other state agencies, which is the Department of Health and Human Services, Veterans Services, and then we work with the State Coordinating Council. So we have a meeting every single month, except for June and July, sorry. June is our annual meeting, and July, we take the month off and we reconvene in August. But we meet once a month and we talk about all the transportation gaps. We think outside the box. We talk about funding, anything to do with community transportation. We try and get all of this work done in a couple of hours on a Thursday afternoon. So if you are interested in learning more about the State Coordinating Council or your Regional Coordinating Council, which Cindy will go into a little bit more in this presentation. But then the other folks that we work really closely with is our New Hampshire Department of Transportation, and then myself, the regional mobility managers, our regional planning commissions, and then our lead agencies are usually our transportation agencies. And they also, most of our lead agents, well, actually all of our lead agencies hold the contracts for the regional mobility managers. And we are all funded, our regional mobility management program is funded through our 5310 federal funding, which is for older adults and folks with disabilities. Next slide, please. And then this is how our regions are broken down. Region 1, which is most of the North Country, we say north of the Notches, is Grafton, Coos County. Region 2, and so Region 1 and Region 2 do not have regional mobility managers at this time. We are actively looking for a new mobility manager. And also Region 2, which is Carroll County. Region 3 is Cindy's region, Mid-State region. Region 4 is Candy Reed, Sullivan County. Region 5 is the Monadnock region or the Southwest region, and Teri Johnson's the mobility manager there. Region 7 is the Greater Nashua area, and that's Donna Marceau. Region 8 is Southern New Hampshire, so the Manchester area, and that's Ben. And then Region 10, our Greater Seacoast area, is Jeff Donald. And Cindy will explain to you a little later in the presentation how you can reach out to your regional mobility manager. So I'm going to turn it over to Cindy now, and she's going to go into the mobility manager's role and a day in the life of the mobility manager.
Right, right. So what do we really do day in and day out? One of the most important things that I do is I work one-on-one with individuals that are looking for transportation. Typically, it's over the phone so that we can talk back and forth. What I'm really looking for is what are the riders' needs? Where are they located and what are their needs? So that I can try to match them with the services that meet those needs. As Teri had mentioned, we do work within that gap between service providers and riders, as well as planners and other stakeholders like the medical facilities that want people to come, or the grocery stores or other social services. I've mentioned many times that a doctor Doctors' offices have been fabulous. If they find out that someone is using, say, a senior bus to get to their medical appointments, that they really work hard to try to book those trips during the times when that community transportation is available to them. So if Tuesday that we're in a particular town, their doctor's trying to book those medical appointments on Tuesday, it makes no sense to schedule a medical appointment if they know that the individual can't get there. And so it's been fabulous with working with us on that. And the same with grocery stores and social services. It makes no point in, if people can't get there to take advantage of services or the supplies that are there, it's really difficult to maintain. So really working with those folks as well as riders and their planners to plan out more options. I do help advocate for the riders. This could be something as simple as, the neighborhood that they live in, there are no sidewalks. So a certain individual, if they're require a wheelchair or a walker, they have a difficult time, or they have to walk in the street, which is not safe. But I've also had some really good luck with individuals that have struggled to get their transportation through their Medicaid. I've actually done conference calls to the broker system to try to learn what the issues are so that I can work with the rider to try to figure out how we can make it better for all of them. And, we've had really good luck with that someone that maybe had missed 3 doctor's appointments by the time they reached out to me. And I make that conference call with the rider and into the broker. And I don't know if it's, they flag that individual or something, but the next few times they do have their transportation has been worked out, and they've been able to get those trips to their medical provider. And another thing I'll do is I'll also either help individuals map out trips. I know last month your lunch and learn with James from the disability group, he mentioned there is a good trip planner on the Commute Smart NH website. But I also use even something simple as Google Maps. They're up to date, or Bing, if that's something that folks, whichever one they're more familiar with. All those other maps and trip planners that are out there work really well. I use Google Maps all the time. I just find it's really simple. But that trip planner that James talked about is also on a website that I'm going to be showing you, Keep NH Moving. And it does have some really neat features to it. So I think that others may find it hopefully helpful as well. So as Teri had mentioned, my region is the Mid-State region. It's all of Belknap, all of Merrimack except Hooksett, and which would be here. And we have 3 small towns in Hillsborough County. We have Hillsborough, Windsor, and Deering is also part of my region. So it's not just a straight county. But so I wanted to make sure that individuals knew that even if they're over in Hillsborough County, that they can reach out to me, or even or those folks that are living in Hooksett, they're going to be talking to Ben because it's part of Ben's region. And each one of us is tasked with learning the transportation that is available in the region and to become, the quote unquote expert on what is there. And so I work really hard to learn about transportation options that are in my region, and Ben does his. So he's the expert in his region. And we do refer riders, calls to each one of us. We will reach out to one another and say, hey, I have someone here. Can you reach out to them? And that seems to work really well. So I wanted to let folks know that if you did not know what was available in Region 3, so I do have Concord as part of my region, and the flagship program here at Community Action Program, or through Community Action Program here in Concord, is the public transportation system here in Concord. It's Concord Area Transit. It has 3 fixed routes that serve the public Monday through Friday, 6 a.m. to 6:30. There is no charge to use any of the transportation services. So you can, if you are standing at a bus stop and want to get on the bus, don't worry about getting your bus fare. There's no bus fare at all. You can get on and get off, ride it all day long, take it where you need to go. All of the vehicles are wheelchair accessible. So they all either have a lift or they kneel. I believe that all of ours right now, I think, are all lifts. And if you're not sure how to use the system, or you're a little nervous about getting on it, number one, you can always ask your driver. The drivers are there. They're very knowledgeable on the route because they're driving it all day. But two, we also have travel training available, either group or individualized. We have a member of staff that will come out and work with you to help get over any fear or anxiety that anyone might have about using a public transportation system. And I have to say too, with 3 routes, you're not going to get lost. We're going to make sure that you won't get lost. And there's only 3 routes. It's not like Boston where there's lots of different routes. So Concord is a really good place. If you've never used public transportation, give it a try, because I think that you'll find that it is super convenient. Don't have to worry about finding a parking spot or any of that stuff. Just get on and get off. To complement the regular fixed route service, we also have some demand response services. One is the ADA paratransit service. That service is designed for those folks that have a disability that prevent them from accessing the fixed route service. So we want to make sure that we are fully accessible to every individual, that everyone can use the service. And for that, some folks, it means that they do require additional assistance. It does run 3/4 of a mile around the fixed route. So this over here, this picture to the right with the yellow all around, that is the 3/4 of a mile around the system. I know that James had mentioned that it sounds like it's limiting, but you can see that it does cover most of the city. And there is an application process. I always tell folks it's a 2-part application process. The first is your self-assessment. The second part is your medical provider's assessment. And we don't dictate what medical provider you get to choose. If maybe your disability involves your eyes, maybe you want to have your eye doctor out that portion of it, whatever makes sense to you. And once we have both parts back, then we do the assessment, the evaluation, and determine eligibility. And we also have Concord Senior Transit, which functions much like the ADA paratransit service. It is think curb to curb. Some folks might think door to door, but we don't go through a door. We just go to the curb. So that is designed, anyone that's 60 or over is automatically eligible, just requires a phone call to get registered. And these demand response services do require that you book your trip in advance, kind of call it like a reservation. And when you make those calls, you are choosing where you want to go. So you give them your name, what day you want to go, where you want to go, how long you need to be there. And they'll book that trip for you, and they'll drop you off and come back and get you at the time frame that you had said that you were going to be done. It does serve, so Concord Senior Transit, we try to stretch it out to serve as many seniors as possible. So in addition to Concord seniors, which they serve on Mondays, Wednesdays, Fridays, it serves those that are 60, older adults, those that are 60 or over, in Pennacook and Boscawen on Tuesdays, and seniors in Pembroke and Allenstown and Suncook on Thursdays. Typically, they're bringing them here to Concord. Again, it's where individuals have requested to go. We also added a Concord shopping shuttle. So every Monday, there is a separate bus just for our older adults to go shopping. And that's the Concord Senior Shopping Shuttle on Mondays. Again, you need to book your trip in advance. And we also have a voter shuttle. So we want to make sure that everyone on those big elections can get to their polling place. This we opened up to anyone that is voting age or older. Anyone that's voting age that's going to their polls can get a free trip to their voting booth, their polling place. And we're really excited about a new commuter route that we started. It's called the Concord-Laconia Connector. It connects to Concord Area Transit down in Pennacook, and it runs along Route 3 through Franklin and Boscawen and Tilton and Belmont into Laconia. So that there's lots of places, there's lots of job opportunities all along that route. It stops at the county complex, so the county jail, and across the street, the nursing home. It does stop at the Veterans Cemetery. I know that there were some folks that we talked to them that they were trying to get out there to, I talked to one individual, he's trying to get to a funeral at the Veterans Cemetery, and he couldn't get there until, now he can. This route is here. It also stops at Walmart and Tanger Outlets and the Belknap Mall. So if you're looking to expand your shopping opportunities, the Concord-Laconia Connector may be the way to go. It is a long trip, so I'll warn people on that because it is stopping at multiple locations. But again, it's free of charge, so take advantage of it. It's there, especially if you're looking to find a job along that route. I have organizations that are telling me that they have jobs out there all the time. And to round off all of our transportation options is we also have Mid-State Transit, which covers the rest of my region for the most part. It has 5 different buses, and we call them in zones. So the colors are the different zones. So there are 5 different buses. There are 2 buses up in Laconia area. There's one in Franklin, one in the purple area, which we kind of call Bradford Warner, and one over here in the yellow area, which we kind of call the Pittsfield area, Pittsfield, Barnstead, Gilmington, Alton. And so that is another shuttle bus. That one works as a combination of the for older adults and folks with disabilities that prevent them from driving. And again, it's a simple registration. We do it right over the phone to get you qualified. And we also have, to make sure that individuals can get to their medical appointments, a volunteer driver program, which blankets the entire region. There is not one space of our region that is not covered by this volunteer driver program. And it uses volunteers in their own personal vehicles to get you to your medical appointments. It is strictly bound to medical for the trip purpose only of medical appointments. And it does have a component to it that if someone requires a handicap accessible trip, that we have partnered with another agency that will do those trips for us. So it is open to everyone. We don't have to exclude anyone due to their disability. And here's some of the stuff that I'm just reiterating what James had talked about last month is that all of the drivers go through the PASS training, which is the passenger assistance training. It is designed it teaches them to be sure how to secure wheelchairs in the wheelchair area of the buses. And there's also other safety components and sensitivity training as well that are involved with that. We make sure, so mobility managers, when we're working with individuals and other agencies, we really want to make sure that all services offer accessible options. I know right now, one of my biggest pet peeves are taxi services. Don't have to aren't required for that, but that's something that maybe we can change that up as we go forward. And we don't just work for those with disabilities. We also protect other minorities as well. We are strictly bound by the Title VI portion of the Civil Rights Act, which protects folks based on race, color, and national origin. That's one thing that our New Hampshire DOT is very proud of the fact that they make sure that all transportation agencies that are receiving any of their funding have a Title VI plan in place, which also, you know, assists folks if they have a different, if they don't speak English, you know, what's the plan? They're asking the transportation agencies, what's your plan for communicating with these people, and other items like that. So just wanted to make sure that we were well aware that we're trying to do all we can to help all sorts of individuals. Here we talked about, I know that Lisa had mentioned that we were going to get a sneak peek at Keep New Hampshire Moving. It is a new website it's a state coordinating council and New Hampshire DOT partnered up. I did just click on the link, and the website is keepnhmoving.com. And I think I have to stop sharing to see the website. Is that correct? Is anyone seeing the website?
If you stop sharing and then you reselect which portion of your screen you want us to watch, you should be all set.
Thank you.
Got it.
Okay. So here on Keep NH Moving, they tried. So the idea was that we were going to collect all things, all information about community transportation, from discussing the ways of travel to how to find a ride. Here we're talking about the different regions, and I'm going to click on regions because that's where we're going to find our contact information. I know Teri had rattled off all our names, but I know I wouldn't have been able to catch that. And so this is where you're going to find that information. So if you go to Keep NH Moving to regions, you'll see Teri's information. If we clicked in there, we'll see Teri's contact information and more about what she's been doing and about her. And I'm just going to click back here. And if you're not sure which region you're in, you can see I'm hovering over region 1 right now, and it's blinking. So that area on the map is blinking. If I move over to Carroll County, it's blinking. Hopefully you guys can see that. And now it's I'm on mid-state. So we're just going to go to mine. And so here we're talking about more about the mid-state and our regional coordinating council. The Regional Coordinating Council is a regional group that we meet quarterly to discuss all things transportation, and they also direct how a particular set of funding is going to be used. It's the funding that provides for services for seniors and those with disabilities. And that's what we call it, the 5310 funding. It's through FTA. And so this group is the Regional Coordinating Council is the group that determines how that funding is going to be used. Again, we talk about what my region consists of, our history. Our lead agency is the Community Action Program. They were our biggest transportation provider, so it made sense that they were the lead agency. And here's our members of our group. And other resources along with our meeting info. You can find that here. You can see our next meeting is August 12th. I believe, give me just a moment. I think my next slide was going to talk about, we're going to, so I'm hesitating because I was going to talk about if you wanted to join the RCC later on the presentation, but you can find that information here. And, you know, if individuals, I can't see my screen. Okay, so to get back to that page, I'm just going to click on the logo again. It's going to bring me back to the home page. I've keep NH moving. And this find transportation near me, it's like a green button right in the middle of the screen. Hopefully you guys can still see it. And I'm going to choose city town. And no matter what town you choose, you're going to find options throughout the state to what's available to us. So we, like I said, we try to collect all of that information. For the most part, these are services that are community transportation. So we tried to steer away from whenever possible, or whenever it was, unless it was really necessary, we steered away from like taxi services and Ubers, but we know that those are also out there as well, but those are paid for services. And I'm going to stop sharing this and we'll go back to our presentation. Give me just a moment.
Perfect.
Okay. Let me just get to a place where I can change the screens. And I am going to hand it off to Ben to talk about disabilities focused initiatives.
Thank you, Cindy. There are several disabilities focused initiatives throughout the state that mobility managers and organizations that we're associated with are active participants in. Examples of these include include various complete streets advisory committees. And the purpose of these committees is not just to improve the quality of roads and sidewalks, but also like the many details in streets that many able-bodied people like myself tend to not realize. That includes the curb ramps that transition from the sidewalk to the road, as well as crosswalks that make it easier for those who are wheelchair bound or mobility issues to transition from the sidewalk to the road. Also, just like sidewalk width and sidewalk quality. It's a common thing I see in Manchester where I'll see people on scooters driving on the side of the road instead of the crosswalk. It could be an indication of just poor sidewalk, or did I say crosswalk? I mean sidewalk. It could be an indication of poor sidewalk quality that could make it hard to navigate their scooter on. It could be an indication that there's not enough curb ramps. All sorts of things that lead people to ride in their scooters on the side of the road, which of course is hazardous and dangerous since there's motor vehicles driving right by them. This is the same thing for Safe Streets for All, two committees that tend to focus on the same thing, make sure that our roads are good not just for walking and driving, but also all forms of mobility, whether someone is, like I said, wheelchair bound, if someone's a cyclist, however people can get to where they need to go based on the quality of these streets. Then, of course, there's ABLE New Hampshire, which is no introduction. It's why we're all here today. Thank you, ABLE New Hampshire. And then, of course, the regional coordinating councils that Cindy highlighted earlier. I'm not going to go into the details about them because Cindy gave a great introduction about that. But on the next slide, I will show, I guess, the outcome of the work that they do. And this example is for my region, the greater Manchester-Derry-Salem area, also known as Region 8. So all the RCCs in the state get this pot of money from the Federal Transit Administration. And the money is specifically for transportation services that are tailored to the older and disabled adult population. So I think they classify older adults as being like 65 years or over. I think that's the official way that DOT classifies it. But essentially, every single service in our RCC that uses these funds, their transportation service has to be accessible to everyone, regardless of their mobility. So these are the transportation services in our RCC that utilize funds from our pot of money. So here it shows these are all like call demand services, by the way. So there's the service of carts in the town of Derry. they received a little over $113,000, and that was for an expansion of an already existing service to add a couple more hours on the weekdays as well as the Saturday service. And that $113,000 led to basically 500 trips. And there's the organization of Easter Seals, which is, I'm sure a lot of people here know about Easter Seals. They're very involved, not just in our RCC, but also other RCCs throughout the state, as well as at the state coordinating council. And they're just one of the biggest champions for the disabled population, as well as the older population in the state of New Hampshire. And they utilize about $88,000 from our RCC, which resulted in them providing 2,851 trips. And when I'm talking about trips, these are trips that are done just in my region, the greater Manchester-Derry-Salem region. So the Manchester Transit Authority, which is the public bus system in the city of Manchester, they operate three different, basically called demand shuttles for the surrounding towns of Goffstown, Hooksett, and New Boston. The funding for these services come out of the RCC as well, with Goffstown and Hooksett getting about $67,000 each for their services, and then the New Boston shuttle getting a smaller portion of $9,700. And you can see that in total, this distribution of funding led to about, do the quick math, 9, 18, about like 2,000 trips in total between these three shuttles. And then, of course, there's Meals on Wheels of Rockingham County, another community service that's has a pretty big footprint all throughout the state. But specifically in our region, they have a transportation service for their senior population that brings them not just to their meal centers, but also to shopping trips and doctor's appointments, anywhere else that get the capacity to bring people. And this use of $50,000 from our region has resulted in them in providing about 1,600 trips. And so overall, our RCC has offered almost $400,000 in funds, resulting in 7,000 trips being provided. And while all these trips aren't necessarily for individuals that are, I guess, disabled, if that's the right word to say, most of these trips are more tailored towards, or I shouldn't say more tailored, most of these trips are utilized more by older individuals. But since they are using this federally provided money, all these trips are also accessible, whether they be ramps for getting on the buses for those in walkers or wheelchair ramps. Every single bus that is used amongst these services has these features because it's required under the American Disabilities Act. And so, and this is just a snapshot of our region. This stuff is happening with every region all throughout the state, all the 8 regions. Next slide, please. And actually, hey, Chewy, I was going to introduce a guest that I brought. He ran off because he was camera shy, but he came back. This is my friend Chewy. He's very happy to be here. And he's also very interested in the work that mobility managers do for New Hampshire's disabled population. And so with that, I'll talk about serving on the regional coordinating count. Or wait, was this my slide or is this your slide, Cindy? Or I see you're waving. I'm going to say that's for me. So basically, as I mentioned, there's the Regional Coordinating Council. These councils are made up of course, us mobility managers, as well as transportation providers, but also municipal staff and human service organizations that represent the key stakeholder groups of people who are historically disadvantaged to transportation access, including the disabled adult population. And so these are public meetings that we always welcome everybody to the table. And the purpose of these meetings and these councils is to build this coordinated network of transportation services that meet the needs of all individuals throughout the community. And so for example, in my region, we had a couple of communities on the outer edges of our region, a couple of rural towns. These are the towns of Deerfield on the eastern part, and then the towns of Ware and New Boston on the western part. These are communities that had virtually no regional transportation service and essentially left their senior and disabled population stranded. People couldn't get to their medical appointments. People couldn't get to the grocery store and purchase food. They couldn't even just get out of the house, and it creates a big issue regarding isolation. And so what our region did is that we worked with our neighboring regions of the Seacoast and the Southwestern region and essentially diverted our funds to those regions where then they use that money to put it into their existing volunteer driver programs, thus having them expand their service back into our region. I didn't provide a slide for this. I really should have now I'm thinking about it, but I hope that my hand motions and detailed description is doing enough justice for that. But so this coordinated effort that we did with the other regions has resulted in a volunteer driver program called Ready Rides, expanding out of the Seacoast into the town of Deerfield. That they launched their service in Deerfield in October of last year. Last time I checked, they had about 48 volunteer trips provided to Deerfield residents, and then many more trips that were provided to residents of their neighboring towns, being provided by Deerfield drivers. And so this investment in the town of Deerfield not only benefited the community of Deerfield, but also the neighboring communities as well. And then on the western half of our region, regarding the towns of Ware and New Boston, my headset just told me I had low battery. I should be fine. So as I was saying, the western half of the region has the volunteer driver program called Community Volunteer Transportation Company. And so we were able to get them on board with expanding their service eastward into our towns of Ware and New Boston. And we've spent the last month or month and a half with the volunteer recruitment effort. And so far, I think they have a total of 13 volunteers signed up with a pretty even split between the two towns. So like 7 from Ware, 6 from New Boston. And they will start providing rides to residents in July, and also most likely providing rides to the neighboring communities as well. So it's this sort of this domino effect that we're doing, where when we bring transportation and access into our communities, it also expands service and expands access to neighboring communities as well. That benefits both the older and disabled population as well. And so I encourage everybody to get involved in the RCC. There's all you simply have to do at the first meeting is just show up, maybe virtually or in person, and just check it out, introduce yourself, and see the work that we do. If you want to get in touch with the RCC, all of us mobility managers are great first points of contact for it, as well as for any other services for transportation or access. We all know the right people to get you in touch with. And so feel free to reach out to us, even if you don't know what region you're in or who to contact. You can still contact me, Cindy, or Terry, because we're all in contact with one another. So we know exactly where to point people. Next slide, please. Right. This is a Cindy slide. I know this for sure. I'll pass it back to Cindy.
Thank you, Ben. Okay, so I know that this was also covered by James in our your last session in April. So I'm going to make this real quick. We'll just touch on it. But if you have a concern that potentially the service is not meeting your needs, or if you feel you've been discriminated against in some way, certainly what my suggestion is first talk to the agency first. It very well could be that there was a misunderstanding, or there could be a reasonable modification that they could make that could fix the problem. And that's what we're looking for, is we're looking for solutions. We're not looking to get people in trouble. We just want to find a solution so that the service can meet the needs of everyone. So I always recommend talk to the agency first. If you feel that is not getting you what you need, reach out to your mobility manager. Like I said, they're great advocates. Many times they have the ear of the transportation provider, and they may be able to explain the situation in a way that, I don't know, that maybe they can get that modified service for you, or explain the situation. Or at the very least, they're going to be able to point you in the right direction on how to file those complaints should you feel that you need to. I do, again, I'm clicking on a link, I'm going to go to concordareatransit.com. So I am going to have to stop sharing, and I will share that website. Here it is. So this opened up Concord Area Transit. And right here on About Cat, we talked, I'm just going to briefly touch on it since we're right here. I mentioned the Title VI plan. You'll find that here under the Title VI of the Civil Rights Act. So you could check out there if you think it was a discrimination on race or color or national origin. Or you'll see here how to file an ADA complaint. I'm going to click on that. And it gives us the instructions on how to do it. And you'll note that it does mention, email your mobility manager. And these complaints do go, so for Concord Area Transit, they are going to me as the first round. Here's the complaint form. It's super simple. It's your name and contact information and what happened. And so we're looking for those. Like I said, it gives you super easy instructions on how to do that. And all complaints that are received for any transportation agency, they are logged. That we're required to keep a log of any complaints. And in addition to that, that if you find that you're not satisfied with the resolution that you received and when reaching out to the agency through their complaint procedure, we also list out who to contact at New Hampshire DOT or at the Federal Transit Administration, so that you can try to get resolution that you're satisfied, that help make you satisfied. Hopefully it's that solution to the issue that you have. I really just wanted to show, you're going to find this somewhere very easy to find on any transit website. And I will stop sharing this. And I will share our presentation again. Did I get the button? Share. There we go. And I'm going to move to the next slide. And there is our contact information. If I'm handing this off to Teri to thank you all for joining us today. And thank you, Lisa and Able New Hampshire, for having us today. We really appreciate it. We are trying to spread the word that there are mobility managers available to individuals to help find transportation options.
So thank you very much, Cindy, Ben, Teri, for working with us today and presenting this valuable information. We're going to open it up for about 7 or 8 minutes worth of questions, and then I will wrap up the loose ends. And by 1 o'clock, we'll be logging off to respect everyone's time. So let's stop the screen sharing so we can see one another, and then we're going to relax the restrictions on participants so that participants, if they would like, can start to turn on their cameras and ask questions. There are a couple of questions that are already in the chat. Creighton, would you share those with us?
Sure. Owen had several great questions. I'll read the most recent one, which is, how many ride programs connect riders between regions? Do you try to match connection points so that someone could take the regional transportation with minimal distance gaps between?
Yes, that's a great question. Usually, and I'll let Cindy and Ben pipe in as well. Usually when the mobility manager is sitting down with the rider or talking to them on the phone, they're going to try and find the most reasonable transportation option with the least amount of transfers. So so let's say you're going from Concord to Nashua. Cindy may sit down with you and talk to you and say, okay, well, you could take Concord to Manchester, Manchester to Nashua, or let's look at some other solutions. So we do, I can't say we do a lot of cross-regional transportation, but they definitely look and find the most, the least amount of transfers.
Yeah, and just to jump in there, I think Manchester Transit does a really good job on this.
Mhm.
They have, of course, they have their fixed route bus service in Manchester, but they have what they call their Concord Express. So it's a bus that runs up 93 into Concord and back to Manchester. And they also have their Nashua Express, which runs down to Nashua and back. So they are definitely crossing regions by doing that and connecting individuals. I think I think that's a great service that they have. We definitely need something going from the seacoast to Concord or Manchester. That would be really nice. We don't have it yet. We got to push for that.
Owen had another question. Owen, are you able to unmute to ask your question about from 12?
Yeah, things I was thinking, one of the other questions I had was um, that hasn't necessarily got answered was the I know that some of the bus rides that got mentioned were specific in terms of elderly and disabilities that prevent their ability to drive. And I guess I would like to have a little bit more information on what those are defined as, because if it's like physical or something where you have to have documentation for in terms of in order to ride these bus systems, you have to have paperwork
What
to
does it
to
really
do.
take to qualify as a person with disabilities or unable to drive?
Yeah, because I have a part of my neurodivergence means my reaction speeds are really low. So driving has been is something that I would need a lot of support for, and I'm not in a place where I can. So for all intents and purposes, I can't really drive, but I don't necessarily qualify like in terms of like GSIL level of sort of definition of that.
So I think to answer your question, Owen, it is going to be up to the agency policies. I know a lot
Okay.
of our volunteer driver programs, you do fill out an application, and if you have, even if it's a temporary disability, if you have, a doctor would have to sign off on it, and sometimes they'll ask, it could be from this date to this date. So if somebody's going in for surgery, they'd be eligible for a volunteer driver program where normally they wouldn't. But as far as the on-demand services at our public transit agencies, I think it's pretty much the same. And Cindy can jump in. She works really
So like
closely.
CAT
Yep. So like Kat,
or
I'll let Cindy answer for her agency.
The ADA is a little more strict. It
Mhm.
does require a doctor's portion of the application. So a doctor is giving their assessment on what the individual can do. It doesn't necessarily require the documentation. It actually says don't staple any medical history or anything. We don't need that. We don't really want it in our file. Just the doctor is just giving their assessment on the individual. Whereas the mid-state transit, which is the one that's out in the two regions, the two counties, that one is it's self-declared. So it's okay. So it's a lot. It's a little bit more flexible.
thing you would recommend talking to my region's mobility manager first and then reach out to the
Sure, you certainly
specific
can.
company, because they'd be the ones to know how specific I would need to be.
Right. I know that I have talked to individuals, and I'm their first point of contact, and they just need to give just enough information just so that it can go on the documentation that yes, this person is eligible for the service. So sometimes that's difficult for individuals, and I can assure you that it's all of the information is kept confidential, and even locked in a locked drawer at night. So a locked file cabinet. I don't know. Did I answer your question, Owen?
Yeah,
It does depend on the agency, like
as
Teri
much
said.
as you really can, because it sounds like it's very program specific.
Right, it is.
As for ADA stuff, this is a question, I guess, back to Cindy and everyone else in the group here. Does ADA policy, is that mostly geared towards like physical disability and mobility issues, or do they also factor in like developmental and neurological disabilities as well?
All disabilities.
Yeah,
All disabilities. Okay.
disabilities.
Okay.
So we have just 2 minutes left, and I know that there are a couple more questions, and we want to honor that, but unfortunately we're running low on time, and I do need to share the last couple of screens with you. We'll stop recording, and then we'll leave the folks with questions here. I want to share that if you have additional questions, there's an opportunity on the feedback form to share additional questions that will be answered for you in the next couple of weeks. And also, we're going to be asking you if you want to be contacted by your mobility manager, or if you want to participate in your RCC, so we can get you linked up for those things as well.
Yes, I would like to do that. I know somebody in the chat just told me the next RCC meeting is 22nd. If I wanted to join the committee, I have to go to that meeting and put my input, or how does that work?
We'll share that information with you just after we wrap up the meeting. Give us just 1 minute to say goodbye to everybody. I do want to say that non-medical transportation service option is our next lunch and learn. That's on June 20th. The flyer is going out, and it's going to be emailed to anyone who completes our feedback survey. We haven't had everyone pre-register for this session, so the only way we're going to know that you want the one pager that we'll produce, and also information about the future the future lunch and learns that we have, is if you at least fill out that feedback form with your email address. The closing survey can be completed by the link that I placed in the chat, and here's a scan code for you as well. However, I'm going to move quickly past the screen and leave you with just the link that's in the chat. I apologize. ABLE New Hampshire is a member-supported organization. We don't have any sort of stable funding. So if you feel like this service is of value to you, if you know anyone who wants us to see us continue the work that we do, and also I want to point out that Creighton's here with us today. She's our unsung hero and employee of ABLE New Hampshire. We couldn't do this without her. We do need to have a way to pay our employees, so we encourage you to become an ABLE New Hampshire member if you can. And thank you so much. Now I'll stop sharing, and we're going to stop recording, and we'll leave the rest of you here to answer any questions that you might want to ask today. Remember, if there are other questions from folks who are dropping off right now, you will be able to get those answers to the questions through the feedback form.